plan to safely and responsibly open our economy in stages on Saturday. You'll get the details in a few minutes. All along, our focus has been to protect the health and safety of Idahoans and preserve healthcare capacity while ensuring a strong economic rebound so that we can restore prosperity we had just months ago. Our collective efforts to abruptly slow the spread of coronavirus back in March and April worked very, very well. By the end of April, we saw a consistent leveling off of new cases. There was no other way to effectively slow the spread of this deadly disease in our state without the actions that we took together. The no-action alternative would have been a catastrophe and ultimately would have led to deeper economic fallout than we're experiencing today. We've taken many steps to alleviate the hardship caused by this global pandemic. Earlier this week, I joined mayors, county commissioners, my partners in the legislature in announcing Idaho will leverage our federal coronavirus relief funds to cover local public safety salaries and ensure that no reductions in public safety during these unprecedented challenges. At the same time, we're giving cities and counties the opportunity to pass on savings to property taxpayers. The move is expected to result in $200 million in one-time property tax relief. That could mean a 10 to 20% reduction in your property taxes this year. We led the nation in our support of small businesses, making a 30-day supply of scarce personal protective equipment available to them and directing millions of dollars in rebound grants to more than 5,000 small businesses in Idaho. We listened to businesses large and small, and we're offering return to work bonuses to get folks off unemployment and back to work safely. The jobs are coming back, but businesses tell me that they're having a hard time recruiting employees. The return to work bonuses are based on a basic conservative principle. We much prefer people working and contributing to our economic velocity to people collecting unemployment. Work strengthens not just the individual and their family, but all of society. However, most Americans out of work due to the coronavirus earn more with enhanced unemployment benefit than their normal wages. A program is expected to expire in 7 weeks. The return to work incentive will get folks back to work now, which helps get our economy going, something that benefits all of us and saves taxpayer dollars in the long run. President Trump, White House officials, and congressional Republicans are looking at similar programs on the federal level. The reason we can direct our federal relief dollars back to taxpayers is because all along we have governed conservatively. We put money into savings, we maintain a balanced budget, we don't incur long-term debt for government operations, and we keep agency budgets accountable and lean. On Saturday, 100% of businesses will be able to open their doors as we enter stage 4 of our Idaho Rebounds Plan. That means visits to senior living centers and other congregate facilities can resume under strict protocols to protect residents and workers. Nightclubs can operate with diminished standing room occupancy. Large venues, such as sporting events, can operate under limited physical distancing protocols. Employers can resume unrestricted staffing, but continue to practice physical distancing and sanitation. Special accommodations for vulnerable individuals should be made. Travel can continue to locations that allow it and do not have significant ongoing virus transmission. Gatherings of more than 50 can occur, where 6-foot social distancing and precautionary measures are followed. I want to stress something very important. We almost did not make it to stage 4 this week. Despite our incredible progress, there are still some in Idaho who are not practicing measures to keep themselves and others safe. Even if contracting COVID-19 is low on your personal concerns, I urge you to practice safe measures to protect others. Community spread is occurring in more than half of the counties in our state. This isn't just a Boise and Treasure Valley issue. Across the country, we're seeing the virus move from cities into rural areas where healthcare access is limited. Our focus all along has been to prevent our healthcare facilities from being overrun in a short period of time. Something that would have had a devastating effect on our lives and our economy. The most effective way to mitigate the spread of virus is through our personal actions. Practice physical distancing. Wash hands and surfaces regularly. Wear protective face coverings in public where appropriate, and stay home if you're sick. Earlier this week, we unveiled the new One Idaho initiative to educate the public on the importance of practicing these measures so we can continue our economic rebound. Our actions moving forward will help preserve the sacrifice we all made early on and continue to make to slow the spread of the coronavirus in our state. I encourage businesses and individuals to go to one.idaho.gov and make the One Idaho Pledge. I'm confident that with the continued support of all Idahoans, our economic rebound will happen more quickly and more robustly than any other place in the country and the world. Now, I'll let Dr. Hahn discuss the specific metrics of us moving into stage 4, and then we'll take some of your questions. Dr. Hahn?
Thank you, Governor. As last time, I will go over the metrics that we use to make the decision. And if you could look, there are screens on either side of the room that I'll be referring to while I'm talking. As I explained last time, we have tried very hard to build metrics. We started off with what the White House Reopening America plan recommended, and then we customized it for Idaho based on the data that we get and our ability to analyze it in a timely manner. So you'll see that's the basis of it. The starting point is to look at just how widespread is the virus, what are we seeing? And you'll see at the top there the number of cases by the date that it was reported to us. You can see there that we talk about a downward trend. It's barely downward. I think eyeball, it's very hard to see that. And we did have a surge in early June. I'll talk about that in a second, why I think our cases went up there. But we are concerned, as the governor mentioned, we are concerned that we may see more cases. And part of that is due to good news, which is that our testing has gone up dramatically. You may have noticed on the website, for those of you that follow it, that our number of tests jumped from 4,000 to 5,000 per week up to 10,000 in the last week of May. We think that's one reason why our case counts went up. We are simply testing more people. And that is, we knew that could happen, and so that is one reason why we have a second measure to look at the widespread, how widespread is the disease, which is the percent positive tests. So you can see there that the percent of tests that are being done out there, the percent positivity has actually been falling, which is a good sign. Partly, I think we are testing more people who are asymptomatic, which is what one of the recommendations is from public health and national leaders, is that we should be testing people, screening people, for example, going into work, maybe going into healthcare, that type of thing. So we think this is a good reflection of more testing going on. And it is somewhat reassuring that we don't have a lot of disease out there that we are not detecting. We still have a ways to go with testing. We'd like to see at least 10,000 a week continue. We are trying to meet the federal goal of testing 2% of our population per month. So we're headed in that direction, so we see that as a good sign. The next area we look at is what we call syndromic criteria. So this is looking at the reason we talk about syndrome is these are people that are showing up in emergency departments, and we don't know for sure they have COVID, but they have an illness that is what we call COVID-like. And we're doing that because sometimes delay in testing, test results may take several days, and we're trying to get a more real-time picture of what's going on in our emergency departments. So this reflects not only people who might be seriously ill with COVID, which is very concerning, but also burden on our healthcare system. How many people are being seen in the emergency department? And then the lower graph looks at how many people are actually admitted to the hospital from the emergency department. And you can see there reassuringly that we are seeing a downward trend, not a very strong one, though we'd love to see that even farther as far as people coming in with that illness. Again, we can't say from this graph how many of those people actually have COVID, but we know that influenza, for example, is decreasing throughout the state. Other respiratory viruses are decreasing. So we think this is probably a fair picture of illnesses that in many cases might be COVID. Our third area, our last area that we look at is healthcare burden of the inpatient situation. How are hospitals doing? And we continue to see good availability of ventilators and intensive care unit beds, as you can see in the chart there. You'll notice a slight drift downward in availability of ventilators and intensive care unit beds. And talking with the hospitals, that is not due to more people being admitted or being in the hospital with COVID. They actually have very few patients right now in the hospital with COVID. But these are people that are now that they've started to do elective surgeries, that some of these people require short intensive care unit care after their procedures. And that is why we're seeing a little bit of a downward drift. So we are not concerned about that from the standpoint of that representing an increase in severe COVID cases. And then you can see on the bottom of that page, we have at least a 10-day supply of personal protective equipment for those hospital workers as of our latest snapshot on June 9th. Lastly, I'll talk about our healthcare workers, and this is another area that we felt that we really are a little bit concerned at some of what we were seeing. We saw an increase in healthcare workers reported. Remember that healthcare workers include anybody that works at those facilities, so it could be janitorial staff, it could be a nurse, it could be a physician. It's all sorts of people that work in these settings. When we looked at that data more carefully in early June, remember this coincides with our bump in testing, a lot of that testing happening by hospitals of their workers. We found that this is not one particular part of the state or one facility. This is really scattered throughout the state. And in many cases, what the investigators found was that these were actually healthcare workers that had actually appeared to have gotten the infection not at work, but in the community from a household member or other community spread. So even though we keep a close eye on this, just keep in mind that healthcare workers getting infected does not mean they were infected on the job. Nonetheless, this is a trend we're worried about there, and you can see there that last criteria we had there, we would like to see fewer than 2 healthcare workers per day reported, and we actually would not have met, if that was our only criteria, we would not have met it because we exactly had 2 per day on average, so we can't consider that less than 2. So that's our metrics. As the governor mentioned, we feel like we kind of squeaked under on this one, and so I just want to second what the governor said, that we are concerned. We urge people to remember that to keep our economy open, we all need to do our part. The disease is still here. It is still circulating in the state. And it's nice to see everybody out there with a mask on. We really appreciate it. And we urge people to continue to physically distance from each other and to wear face coverings. Thank you.
Thank you, Doctor. Okay. Well, our goal all along was to meet these. I mean, all our guidance, everything that was out there, and the last slide was the one that we're right on the edge on. But the real critical issue, our real critical issue is that red line. And in all reality, in other states, ICU capacity and hospital beds is really on the edge. And as Dr. Hahn alluded to, the use of our ICU capacity is not for COVID. That's the most critical, but that's why we aggregate all these other data. We made it, but we're not spiking the football. What I need your help, collectively, all of you, is to continue to send the message out to Idahoans about how important all those things that both Dr. Hahn and I talked about. Betsy.
On the healthcare worker inspection criteria, the chart that you distributed goes through June 9th, which is 3 days ago. Yesterday, there were 7 new inspections on healthcare workers according to the state's data. It doesn't appear to me that we actually have shown either a downward trend or less usage pay on healthcare. Why did you choose a period that does?
You're going to have to have Dr. Hahn answer that one.
Sure, Betsy. So if you go back to our previous metric, we start with the day after, if we can, we start with the day after that and do 2 weeks. And we had to pull that data yesterday morning before, as you know, we get reports every day and we summarize them during the day. So we made that call. I'm hoping that is going to turn out to be, one spike, and maybe we'll see a decrease after that. But that data will go into our next 2 weeks of measurement, and we might decide that the healthcare worker problem is ongoing or growing, and it might be enough to not get us forward. But the data that we looked at did show a decrease, and we felt like we made it. Go ahead.
Just last weekend, we had 2 days of much higher increases among health workers. How is that created a decrease in pattern?
Yeah, so,
It's my math, but I'm having trouble understanding.
yeah, Betsy, and I'm happy to, I don't want to get too deep into it with everybody, but I'm happy to talk to you. I think probably what you're seeing, as you know, when we get a report to the state, we put it up there every day in the spirit of transparency, which is new cases that we just heard about that day. So we call those date reported, I think notified, the date the state was notified is the term we're using now. But the date that it was reported, which is used for all of our metrics, is sometimes the local health department heard about it a day or two earlier. So the date reported may not match the date we hear about it. Sometimes the districts take a day or two to investigate. So I can't exactly speak to what you're speaking to because I haven't looked at those 9. I think you said 9 yesterday. I haven't looked at those yet. 7, sorry. I don't want to inflate it, for heaven's sake. I haven't looked at those in particular yet, but this is where we try to be as transparent as possible. And as you well know and we've talked about, what that means is that we're showing you data that can sometimes change or look different. We try to minimize that, but by showing you stuff quickly, it's always listed as provisional, and it can sometimes change as we learn more. And I'm happy to look at that with you and see what happened there. But some of those might have been, again, reported to the district a few days earlier or even a week earlier. If it takes them a while to investigate it, we might not hear about it right away. I just can't speak to it more specifically without looking at it.
I would add the one thing we did know, because we saw that, is that it's not in one area. The healthcare workers are scattered around the states.
I
Yep.
have 3 questions from Scott Williams, district.
His limit's 1, but go ahead.
Talking about the return to work incentive, do you know how many people signed up and how much money spent, how much money remains?
No. I think we can do these fast if they're like that.
We've been hearing from Idahoans who have started back to work or plan to at some point this month. They've never received any federal or state unemployment benefits in their weeks and weeks of being laid off. They've had to use some savings or borrow or just do without. Did the state and federal government fail these citizens?
Marissa's telling me I have to repeat the question. The earlier one was easier. Well, the question is about the number of people that, some of them have returned to work, some of them haven't, that aren't getting benefits. Once again, as I have, I think every time I've been asked about this, yes, the state and federal government did fail. I readily admit that. I will tell you that we put people, we put training, we put hardware, we put software, we put a call center, we're changing rules, we're changing management. Yesterday, I had 2 different meetings about it yesterday. We believe we're on a pathway and I don't want to commit, we believe we're on a pathway to have all these addressed in a matter of weeks. And the numbers we were looking at 2 weeks ago was a matter of months. So we've made progress. I know that people are getting the benefits. The call center, when it first started out, just got absolutely slammed. The call center did. And a lot of these issues have to go to the federal level. There's guidance, mixed guidance coming from the federal government about how we confirm the employment of these people, the people that are making the claims. There's the traditional unemployment who are in our system, and then there's the new people, the pandemic program, that aren't in our system. We have to build a whole new file on them. Originally, the feds said, oh, just let them self-certify and send the money out. Then they came back and said, don't. That's part of the problem. But Scott's question about did the system fail? Yes, it was overloaded. But Congress wanted to get this money out as fast as they could. Labor asked that it not be. They knew that all the state labor departments were going to be overridden, but they had to put it somewhere. But I would say, yeah, the system failed. We have every intent of having it fixed, but my heart goes out to those people. Oh, well, absolutely. Some of the states that had done a better level of automating, we're one of the only states where everybody files online. And so the filing was easy, but the problem is there's all these complex, there's 80 different issues that we have to address in some of these unemployment claims. And if it was just a state program or even just a federal program, it'd be easier. But those two programs conflict in many issues. But I think we're going to get there. Some of the states had it more automated to where when you filed, you got a query back that said, this isn't right, this isn't right. We didn't have that in Idaho, and it caused a lot of phone calls to go back and forth on an overworked system, which went from only 1,000 claims to 30,000 in a matter of 2 weeks.
Scott's last question is about adjudicators. How's it going with hiring more adjudicators? How many adjudicators are there? And do you know how many claims each one is assigned to?
We actually the question is about adjudicators, and adjudicators is a technical name for the people that really do the technical issue, that know all of these 80 different issues, that know how you confirm that they weren't fired, how you confirm that they aren't getting benefits in multiple states, how do you confirm that it isn't a scam like some of the other states have gone, where they've shipped millions and millions of dollars to scam artists that are based overseas. Those are all and the adjudicators are skilled people. So I just can't hire a call center or hire people off the street without taking my trained adjudicators and having them lessen their throughput as they train the new adjudicators. But we've got a pathway. We think we're going to get there pretty soon. But I don't know how many adjudicators, and we'll get back to you on that. Joey?
What happens if the number of cases spike, especially among healthcare workers? Does the state extend stage 4, or is there a chance we go back, into phase 3?
All options are on the table. It's all dependent upon the magnitude of the spike. The critical issue is that we have, and we haven't even gotten to the blue bump. We didn't want the orange bell-shaped curve because we've been able to address these people in this issue. But if we get close to that red line, if we see a trend, if the statistics that Dr. Hahn alluded to, there are lots of options. It probably won't be statewide. If you're in Shoshone County, where you've yet to have one case, and it's in the lower or upper Snake River Valley, then it'll be more regional than it will be statewide. But it's all, we have to have flexibility on how we address it and which particular metrics. But if we don't have enough healthcare workers or don't have enough ICU capacity, like some of the states are addressing right now, the response will be address the magnitude of the problem. Yes, Keith.
Concludes on June 26th. Do you see the state kind of saying this
Well, Keith's question is, at the end of stage 4, what next? You can go to Dr. Hahn and Director Jepson's website and see all the guidance that's there. These are all recommendations, guidance that we didn't have in any of these, whether it be a church service, whether it be a long-term care facility, whether it be a restaurant, whether it be a movie theater, whether it be any of the items, and of course, the announcement and what's going to take place Saturday are long-term care facilities, which we all know are some of the most sensitive areas we have. All that guidance, all that direction is going to stay in place, and then it'll be adoptive. It'll be adoptive to new science we get from the federal government. It'll be adoptive to how our testing is progressing. Are we addressing the testing desert? It'll adapt to what we have done in tracing. So the answer is at that termination date, at stage 4, there will still be a lot of guidance that we have out there, but the restrictiveness of it will be directly proportional to the behavior of businesses and individuals going forward to suppress the numbers going forward. So, Melissa.
Consistently have been looking at demographic trends for new cases. The age group 18 to 29 years old has been far and away the most cases in Idaho. Is there anything being done to direct messaging at this group of young adults who may be testing positive for a multitude of reasons?
Well, our One Idaho is directed at a broad demographic, but you bring up a good point that is some of the areas that we talk about, and that's why nightclubs are in stage 4. There's no question about it, but we need your collective help, and that's a good suggestion. We'll look at directly targeting some message. There's some of it there. But as we see those numbers come in, that's good counsel and advice. Betsy.
Well, I have a question for you about contact tracing. During your AARP call-in this week, there was a caller who asked, how come contact tracing in Idaho doesn't include publicly announcing where a person who tested positive has been, what stores they visited, on what days and so forth, so that all of us who were in the same place will know and can protect ourselves. And I didn't hear the question answered. Contact tracing in Idaho, as Director Jepson explained, is very much just going to the person, asking who they've been in contact with, and then talking to those people about who they've been in contact with. But nobody knows who they were in contact with at the grocery store or in other public places where there are many people. How come Idaho has not taken that step as part of our contact tracing?
Well, the question is on contact tracing and what we do, and I'll let Director Jepson talk about some of the details of it. But in other, particularly Asian countries, it's more tracking than tracing. Our model that we've had is predicated on if you test positive, you have a lab confirmed positive test, where have you been, who have you been in contact with? And of course, as the science evolves, if you walk through a grocery store and don't cough on your neighbor and maintain, it's way different. I would submit that it's probably not a good idea that everybody in the grocery store gets contacted and said there was someone there and to panic about it. So I'll let Director Jepson does a good analysis of how our tracing system works versus a tracking system that exists in particularly Asian countries where the whole concept of personal private security is different than it is here in the United States and particularly in Idaho. So.
Thank you, Betsy, for the questions. Appreciate that. Just to answer the question directly, in the course of a contact tracing, if that's done at the public health districts, and if in the course of that they determine that it's important to disclose a location where a person was, either because they can't track individuals or there might have been a risk of exposure, that will happen. And that actually is consistent with what we've done with other illnesses and foodborne illnesses in particular when we have a case in a restaurant, for example. And just in case, in fact, this week we had a case in the Bannock County area where a restaurant was mentioned where a worker had been infected, and they publicly announced that had been happened, and if people had been to that restaurant to contact the public health district. So I want to assure you that we're going to do what we can as a public health in Idaho to let people know if they've had an increased risk and what they can do about that. And then on contact tracing, I would just, just emphasize again that that's a voluntary activity where when somebody's been infected, somebody from the public health district will call. They'll do two things. They'll help them understand what precautions they need to take to keep those around them safe until they recover, as well as discuss who they've been in contact and where they've been so that the appropriate actions can be taken, which would be reaching out to those individuals that they've been in contact with, letting them know that they may have been exposed. They won't reveal the identity of that person. We protect their privacy. And then we'll discuss with those contacts what the appropriate course may be, testing, symptom monitoring, isolation, or they're all good based on the situation. So that continues to be an important part of our strategy. As we move forward, it's important that we have both testing and tracing so we can know exactly, to the best of our ability, where the disease is, and we can take those appropriate actions with specific individuals or locations, as you've mentioned. I will just mention that when we started this experience, we had about 23 contact tracers in the state, give or take a few that are trained. We had a goal to get to 250 contact tracers by the end of May. We achieved that goal, and we have a goal to get to 540 contact tracers by the end of August. It's a very manually intensive work, and we are on track to do that.
Might be a question for either you or the architect.
I'm sure it is.
I'm curious whether the department is tracking deaths of despair, so suicide, overdose, alcohol-related deaths, and whether there's any coordination with either the local treatment centers or perhaps the Office on Drug Policy to address issues related to addiction, and how to treat substance use disorders in a time of increased stress and increased addiction.
Well, the question is about increases in the level of behavioral health issues, and most importantly, behavioral health deaths. And I'll let Dave talk about it. I had a call yesterday with the opioid task force, and then 2 weeks ago I had a call with the Supreme Court. As most of you are aware, we instituted a behavioral health council, which is the executive branch, the judicial branch, and the legislative branch, to look at the totality of behavioral health issues. I emphasized to our opioid working group yesterday about how important their input is into some of the activities we have. We know that there's more stress in a lot of areas, but and maybe Dave can respond to this. One of the things that has been if there are any benefits, is our delivery of remote healthcare, of telehealth, and the delivery of telehealth in the behavioral health area. I was a bit of a skeptic, but the evidence is compelling about how effective the delivery of telehealth is. As you're aware, you may be aware, a lot of our telehealth was because I waived some rules at the state level, and the federal government waived some rules. We're trying to aggregate those rules so that when we get out from under the emergency order, we can continue with the efficacy of that. But I'd let Dave address that.
Thank you, Melissa, for the great question. Clearly, the pandemic has created extra stress on everyone, including all of us here in this room, actually. And that's led to an increase, as far as we can tell, in certainly anxiety and potentially depression and other behavioral health issues. It's something we've been concerned about from the very beginning. We do track the death data, and it clearly even one suicide is too many suicides in the state. But we actually have seen a slight decline in suicides over the last couple of months, which is surprising to us, but a good thing. We'll take that whenever we can get that. We do continue to monitor the health of individuals. We have stood up a crisis health line that's staffed by the Behavioral Health Division at the department. It's 24/7, and individuals can access that either through 211 or through the coronavirus 800 hotline, or it might be 888, but the coronavirus hotline that's on the website. And that's available for individuals that may need access to immediate help or a direction to services that are available. As the governor mentioned, throughout the pandemic, through his executive order action and waiving of rules, we've been able to greatly expand the use of telehealth. I was just looking at that data this morning, and for behavioral health, the same time period, this is in Medicaid, for this same time period, March, April, and May, last year, we had roughly about 450 telehealth visits. In this last period of time, we've had 53,000 telehealth visits in the last 3 months. And that's actually expanded to include substance abuse, as well as just not just your normal counseling. So we will get back to both telehealth and normal visits as appropriate. It's very important to us to stay on top of helping the citizens of Idaho manage the behavioral health side of this, and we'll continue to focus on that.
Did I hear you say that you want to extend the telehealth rules to the second day for the emergency to
Absolutely. We'll look at all of them, both the federal rules, and Dave can talk about this, but the ones that we waived. But what's Director Jepson deals with Medicaid and Medicare. Private providers, whether it be a business that provides the benefit to their employees, or the carriers in Idaho, have all been very, very helpful in expanding telehealth in Idaho. We went, and Dave may know the numbers, we went from being one of the lowest states in telehealth to one of the highest in a very short period of time. But it was a combination of our hospitals, of our providers, of the people that pay for insurance, of the department, of everybody collectively addressing what we always knew we had in Idaho, which is really shortage of health care. We've got, we talk about testing deserts, we've got healthcare deserts. We've got a lot of Idaho where there isn't a lot of health care. And that puts me into another issue of one of our recommendations that I think I signed yesterday is about $50 million more into expansion of broadband, because whether it's healthcare, whether it's education, whether it's business, whether it's any of these areas that don't have broadband, we're going to leverage those federal dollars with other dollars to try and expand that, and telehealth will be a big beneficiary. Did I miss anything, Dave? Okay. Joey.
I wanted to talk about the senior living facilities and allowing visitors to come back in. Are those protocols going to come from the state, or are they going to have to come up with them themselves? And then what do those protocols look like to protect the residents and the workers in those facilities?
Well, I'll let Dave talk about the specificity of it, but it is critical. That's one of the questions early was about going into stage 4. That was one of the areas that were really, people's access to their loved ones in these healthcare facilities. The mental health of these people in these healthcare facilities is very, very important. So I was on a call with some other governors, and they were talking about what they were doing in other states, and I said something to Director Jepson, and they're working on it, but he can talk about the specificity of the guidelines for a long-term care facility.
We will issue state-level protocols and guidance, just like we have with many other categories. That'll be up today. It's been reviewed by we have a long-term care strike team that we've had since the beginning, who's helped us to craft that. That's made up of both professionals in the industry, and public health officials as well. We've gotten feedback from all the public health districts and had input, frankly, from families and others as we've thought about that. That guidance will be up later, probably shortly after this press conference, to help those facilities know how to manage that. It remains a concern of ours. We know that a case within a long-term care facility can be devastating. So that protocol, I want to be clear that we will not be opening the doors and business as normal on Saturday. Those facilities will have very clear guidelines and approaches to both keep those residents and staff safe, as well as those that are visiting. And it'll include protocols of sanitation and specific places to meet and leveraging outside, frankly. If the weather's good, that's the best place to have some of those, and possible for the resident to have some of those visitations take place. We are simultaneously nervous about that, as well as excited about that, because we know that for many of these families, it's been a long time since they've been able to have direct contact with their family members. So we would just ask those that have individuals in long-term care facilities to please respect those protocols. They're there to protect your family member and you, but we want to have a path for you to get back into some regular contact.
Betsy.
Governor, with regard to visitation in long-term care facilities, there certainly has been a rise in drumming around the state about the impact of cutting off visitation on the mental health of residents. In all of your previous stage announcements to move to the next stage, you've moved something up. Given the fact that we are so close, just squeaking through on the criteria this time, why did you not move up that visitation protocols, but hold off on stage 4? Is that something you consider?
Well, we considered everything, but they are such a sensitive population. I mean, people in mass incarceration, whether it be jails or prisons, and people in long-term care facilities are where you see, the most disproportional impact from the coronavirus. So that was why it was moved into the latter stages, and it is in this last stage. But collectively, over time, that emotional distancing of people with their loved ones starts to have a counteracting effect. What's changed all along is our testing capacity, which was really critical. Director Jepson, we are up to where we can do perhaps 20,000 tests a day if we need to. So if we have a run particularly in a community where we have multiple long-term care facilities, we have got to have testing and tracing capacity. So the growth of those two tools that we need made it to where we could open the long-term care facilities up. I think that answers your question, doesn't it?
I have a question outside of the reopening, and I mean, I'll appreciate it, just a comment on the digital outreach.
Well, it's, well, I guess some certainty is a relief, but, most people, and I was in that camp, thought that the final outcome was not going to be great. And I feel terrible for the family and the community over there. But some certainty is probably somewhat of a relief, even though it's a sad, sad, sad day for Idaho.
Physical distancing at places like sports venues, what is that going to look like necessarily? I know Boise Hawks still are undecided if they're going to have this season or not. What would that look like if they did decide to play some games?
Well, we'll be issuing guidance on it, but it really, it's pretty universal. You're hearing the NBA and the professional baseball. It's, where are those points in a venue? And a lot of it's the entry point and the exit point, the bathrooms, which are always an issue, whether they be in our parks and playgrounds in Idaho or whether they be at one of those venues. Obviously, any of the concession areas, those are all being addressed. And it doesn't matter whether it's a semi-professional baseball, a Boise State football game, a rodeo. the protocols that we have tried to emphasize over and over and over that we have here are going to be necessary in those areas. All those sacrifices that everybody made in Idaho are dependent upon the collective compliance of people, whether they're going to the grocery store or whether they're going to a hockey game. Outdoors is always better than indoors, but you know, common mixing points for people to go in. What do you do about capacity? It's just like restaurants. So it's not uncommon from all the other things. It's that common denominator of that spacing between you and I to where if, heaven forbid, one of us coughs or sneezes, that we've got a face covering on and that we're maintaining those distancing. So it's common with everything else. The one things that we had to open right from the beginning were healthcare and people's ability to eat, grocery stores. Betsy, one more. Okay.
Governor, all of your previous stages strongly recommended that employers allow workers to telecommunicate if that works for business purposes. I did not see that in stage 4. Yet many businesses have found that many of their workers can telecommunicate safely and effectively. Are you continuing to encourage that or not?
Well, yes, and it goes back to the question about sport venues. If you've got a workplace where people, where you've got the higher level of hygiene and you need the people back there, but if you've got a place where work can be done efficiently from home, you should do that. It's all about minimizing transmissible moments in the transmission. But for the most part, people can get back to work, but all these protocols that we're talking about are so important. And if you're the employer, you've got a huge incentive to make sure that the behavior of your employees, not only for the sake of the employees, but the sake of your customers, is safe, and that all these other protocols are followed. And I just want to end by emphasizing that one more time, that at this point in time, it is really critical that everybody in Idaho be part of this team to modify their behavior. I am convinced that if we do that, just like after the 2009 recession, Idaho will lead the nation and the world in their economic rebound. But it is dependent upon each and every one to practice that good behavior so that we can manage this until we either get a good therapeutic or a vaccine. So with that, thank you all very much.